Right, he's going to make it cool. Thank you, Jason Bristol. If you've ever asked AI about your symptoms, you're not alone. I've done it. Who hasn't done it? A new survey shows half of adults are doing just that and making major health decisions from it. Okay, I'm not doing that. Here to help us put the findings into perspective, Dr. Hiten Patel from The Ohio State University, who analyzed these survey results. Thank you for joining us. Good morning.
Good morning. Thanks for having me.
All right, what does this survey tell us about how we are making health decisions today with the use of AI?
Yeah, so I think the survey really highlights that people are looking for answers, right? It's really difficult sometimes to get into a physician, to get into the doctor, and even get responses. So gone are the days, I think, of Dr. Google or WebMD, because AI certainly has the ability to customize kind of to your own specific health situation and your own health needs. So I think people are using AI because there's certainly a big challenge with access to our healthcare system.
Oh yeah, no, great point. Now, where can AI actually be helpful in identifying systems? And then on the other end of the spectrum, where is it just too risky?
Yeah, so that's a great question. I think, currently where we are, well, it will change as AI evolves. But right now, I think AI can really be helpful, particularly in personalizing treatment plans. So often you get about 20 minutes with your doctor, if that, during the visit. And so it's really difficult to get specific personalized treatment plans on if you're trying to change your diet or exercise or physical therapy for back pain. So AI, you can really provide it your context, how much time you have to do something, what your dietary preferences are, what equipment you have at home, and it can really personalize and provide that information to you on what to do at home. I think it's also really helpful understanding results. So I just had a patient the other day say that they used it to help explain a CT scan result, which, paragraphs of information there. So AI can really be helpful in explaining some technical terms. Where I think it can be difficult in that same example of a CT scan, it doesn't really understand context. So, it may say you have a lung nodule or a lung finding, but it doesn't understand that may have been there years before, and that's the same. It also, another big risk is it's pretty confident in what it says, and it can't really be relied on at this point to make a diagnosis. And so it may be something where patients or viewers may take this as being completely accurate, but it may not be accurate.
Yeah, I can imagine if you've got some questions before you go into the doctor and you ask it to analyze some stuff so that when you're with the doctor in person in those crucial 20 minutes, you've got more informed questions, maybe. I don't know. I haven't done that, but that makes sense to me. Is that bad advice? Don't let me give bad advice.
No, I think that's perfect. I think, unfortunately, a lot of the times I see that patients come to their visit and they're like, oh, I forgot, there's something I wanted to ask you, but I just can't remember. Yeah. So I think AI can be really helpful to prepare before the visit. It can kind of ask you questions about what's going on with your health and really try to gauge what questions to ask, how to ask those questions, and provide more context, right? Like when you come to the doctor, you may say, oh, I've been having this pain in my knee, but you may forget to kind of think about what specific symptoms you're having, how often you have it, what causes the pain to be there. And so kind of using AI to help prepare, kind of find out what symptoms you have and to kind of have a list of things before you go in can really be helpful.
So I'm curious
expedite the visit.
I'm curious what you think. Sorry for cutting you off. You mentioned earlier this is where we are right now. It'll evolve in the future. Where do you think, looking at what we can do now with AI, where it can really be helpful as this evolves? Just in the past year, it has evolved so much. I'm curious whether, as you look ahead, you see more danger, more risk, or more safety, or maybe a mix.
Yeah, I think it's hard to tell. I am not an expert in AI. I'm an expert in the implementation, hopefully. But I think where I see it being really potentially helpful is in healthcare. So one of the things that I find as a healthcare provider is that I am, there's every healthcare provider has those days where they're tired, or they may not be in the right emotional state, or they may be overworked, and mistakes can happen. On the same side, from a patient's perspective, you just don't remember everything that you want to say. So I think AI has the potential to serve as a safety net. So maybe it can't make the diagnosis quite yet, but it can provide specific diagnoses that doctors may miss because they may not have the full context of a patient's history. We can't remember everything that a patient said in the entire chart. We can't remember all their tests and the lab results. So AI has the potential to kind of summarize and provide all that to the doctor, and then the doctor therefore can't hopefully avoid making mistakes based on that.
Makes a lot of sense. Love that. Thank you, Dr. Patel, for joining us this morning.
Thanks for having us. Appreciate it.
Great information there.
Fascinating. And save time so they're not trying to sift through all of your history before you walk in the door.
I know, you forget. You're thinking, I'm the only patient. But
They
there's
have so
many patients.
Yes. All right, coming up, a Beaumont